The sacrum and the coccyx. This is the sacrum. Together with the coccyx, these two individually shaped bones form the most distal part of the spinal column. The sacrum is typically composed of 5 fused vertebrae, whereas the most typical form of coccyx essentially would put 4 coccygeal segments together to form a single tailbone or coccyx. This is the dorsal side of the sacrum, and this is the anterior or pelvic side of the sacrum. Let's stay here for a little while in order to find out the details that could be identified on the anterior or pelvic side of this bone. As it has been mentioned earlier, sacrum is composed of 5 fused sacral vertebrae or sacral segments. Here we have the first, the second, the third, the fourth, and this is the 5th segment of the sacrum. On this anterior side, we can identify points of fusion between bodies of sacral segments, indicated in the form of these transversely running lines known as the anterior sacral lines, or transverse lines of the sacrum. Also, it is possible to see 4 paired anterior sacral foramina. They are here in lieu of intervertebral foramina, so sacral nerves. Once they pass through the sacral canal, which runs the longitudinal axis of the bone, essentially would use those openings to get out of the sacrum, out of the sacral canal, and re-emerge within the true pelvis. Before we move on to description of the bone from its more interesting dorsal side, we need to identify 4 main parts that this bone would offer to us. Its uppermost part is known as the base of the sacrum, where it's the tapered end usually is known as the apex. 2 lateral parts observed on each side of the bone are frequently referred to as sacral alas, or wings of the sacrum. This is the dorsal or posterior side of the sacrum. Once again, we can identify its most superiorly oriented part, which is known as the base, and this is the area of the apex. Ala of the sacrum could be observed from the posterior direction as well. On the base of the sacrum, as one can see here, we're finding 2 superior articular processes of the first sacral segment. Here they are. In order to form the last mobile joint within spinal column between L5 vertebra and the sacrum, those articular processes of the sacrum will also exhibit facets that would be complementary and good match for inferior articular processes of vertebra L5. Throughout the length of the sacrum comes the continuation of spinal canal, which has been formed by vertebrae. It is called the sacral canal, and as it runs longitudinally throughout the bone, the exit from canal could be seen here at its apex, which is known as the sacral hiatus. The hiatus is marked by sacral opening inferiorly, as we can see it here, and there are 2 prominent bumps that are known as the sacral cornua. Corn means a horn, so we have a plural that is sacral cornua, marking the end of the sacral canal. As mentioned earlier, sacrum is composed of 5 sacral vertebrae that fuse together, and as a consequence of their fusion, we're seeing multiple marks that identify presence of individual sacral vertebrae earlier through our development. Once the bone has been fully fused, practically we're now identifying several longitudinal running bony ridges that are a consequence of fusion between different parts of sacral vertebrae. The first one that we're pointing here is known as the median sacral ridge, and it has been formed by fusion of spinous processes of sacral vertebrae. Another ridge is present, and it looks like it has been nicely aligned with the position of articular processes. That one is known as the median sacral crest or median sacral ridge. Finally, between fused transverse processes or costal processes, if we use a different terminology, we're finding the third lateral most oriented ridge known as the lateral sacral crest. So once again, this is the median sacral crest, fused spinous processes, medial sacral crest, identifying fusion between articular processes, and the lateral sacral crest as a consequence of fusion between transverse processes. On the dorsal side, the bone also offers four paired openings, dorsal sacral foramina, and as it has been said for foramina on the anterior side, those openings are used to allow passage of spinal nerves, sacral nerves in particular, to get out of the sacral canal and to reach the posterior aspect of the pelvis. In order to complete the presentation of sacrum, we'll have to turn the bone sideways to be able to observe either its right or left lateral aspect, where area that dominates on the lateral side of the bone. In order to complete the description of the sacrum, we'll have to take another look and turn this bone sideways in order to be able to see its lateralmost surface. Once we have done this, we're actually putting sacrum in its much more anatomical position, that essentially is putting the bone to sit within the pelvis, almost horizontally, as opposed to what most diagrams would illustrate and keep the bone running perpendicularly. So we will opt for a more anatomical position of the bone. On the lateral side, what dominates the image of the bone is this huge articular surface, which is quite uneven, however it's still covered with hyaline cartilage. The name of it is the auricular surface. It comes from a Latin term aurus, which means the ear. It is somewhat shaped like external ear, hence the name. Immediately further posterior to the auricular surface, we're finding the area that the bone exhibits unusual roughness. That is known as the sacral tuberosity. It is worth mentioning at this point that auricular surface of the sacrum will make a direct contact with the same name articular surface found on the hip bone in order to form the sacroiliac joint. The iliac part of the hip bone, the uppermost part of it, will exhibit both auricular surface of the ilium as well as tuberosity of the ilium that will be opposed exactly against the tuberosity of the sacrum. That area on both bones will be used as the attachment of exceptionally strong and thick ligamentous fibers that will reinforce the sacroiliac joint and determine the amount of movement which can be permitted between two bones.